Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to look at pneumonia. So we are going to look at the causes, the symptoms, the treatment and prevention. And if you are new or you haven't liked this channel, please do consider liking, sharing and subscribing. So what is pneumonia? So pneumonia is an infection of the lung, parenchyma, alveoli and intestinal tissues, characterized by inflammation and fluid or pus accumulation in the alveoli, leading to impaired gas exchange. So there are various types of pneumonia, and the various types can include 1. Community-acquired pneumonia, which is contracted outside healthcare settings. We can have hospital-acquired pneumonia, which develops more than 48 hours after hospital admission. We can have ventilator-associated pneumonia, which occurs more than 48 hours after endotracheal intubation. And we can also have aspiration pneumonia due to inhalation of oral, pharyngeal, or gastric contents. So what are the causes? There are various causes of pneumonia. So the first one I'll look at is bacterial causes. So for bacterial causes, they include things such as Streptococcus pneumoniae, which is the most common, and we can also have Haemophilus influenza, Staphylococcus aureus, Klebsiella pneumoniae, and Pseudomonas aeruginosa. And for viral causes, we can have things such as influenza, respiratory syncytial virus, COVID-19, and adenovirus. Coming to fungal causes, we can have things such as Pneumocystis jirovecii, Histoplasma, Cryptococcus, Aspergillus. So this mostly occurs in immunocompromised for fungal causes. And then we can also have parasitic or mycoplasma causes of pneumonia, which include things such as Mycoplasma pneumoniae and Chlamydophila pneumoniae. So having looked at the causes, what then are the risk factors for pneumonia? So we can have age, for instance, the very young or the very old. We can have smoking, alcohol use, chronic illnesses such as COPD, diabetes, heart failure. You can also have it especially in immunocompromised individuals, those on cancer treatment, or those that have HIV. Also recent surgery or hospitalization, aspirational risks such as stroke patients or unconscious patients are also at risk of acquiring pneumonia. So what are the symptoms? So patients can present with a cough, which can be productive or dry, fever, chills, shortness of breath, chest pains, fatigue, malaise, tachypnea, tachycardia, and confusion, especially in the elderly. So what are the signs on physical examination? So there will be dullness to percussion, decreased breath sounds, bronchial breath sounds, crackles, rales, and increased tactile perimeters. So you might need to do various investigations to investigate pneumonia, and the investigations include things such as the full blood count, the chest x-ray, sputum culture, blood cultures. You can also do your urine antigen tests. And if you're suspecting COVID, you can also do COVID-19. You can do your CRP to check for inflammation markers as well. You can do your ABGs to assess oxygenation. And what's the treatment? So the treatment is based on the setting and risk factors. So for instance, for treatment, basically mostly is empirical antibiotic therapy. And if you have a setting where it's an outpatient and there are no comorbidities in this patient, so you can just prescribe amoxicillin or doxycycline or macrolides such as azithromycin. Yeah, and then if it's an outpatient with comorbidities, you might want to use a combination of amoxicillin slash clavulanate plus a macrolide. Yeah, and if it's an inpatient but non-ICU patient, you can give them IV ceftriaxone plus azithromycin, yeah, or IV fluoroquinolone. And if it's an inpatient and ICU patient, you can give your beta-lactam plus a macrolide or a fluoroquinolone. Yeah, you can also for aspiration pneumonia, you can give a combination of amoxicillin, clavulanate, or clindamycin, or metronidazole plus ceftriaxone. Yeah, and also you can do supportive care where you give IV fluids, oxygen therapy, antipyretics, for instance paracetamol, bronchodilators if there's bronchospasm. Yeah, and what are the complications of pneumonia? So you can have things such as pleural effusion, lung abscess, respiratory failure, sepsis, emphysema, and death, especially in the elderly or comorbid patients. Yeah, so what's the prevention? So mostly you can vaccinate, influenza vaccine, COVID-19 vaccine. You can practice good hygiene and hand washing and lifestyle changes. We mentioned that we talked about the risk factors such as smoking, so you have to cease smoking, stop alcohol, and also manage chronic diseases early and promptly, and properly. So this is just a brief discussion on pneumonia. See you in the next video. Make sure you share and subscribe. Thank you.